Hi everyone, so this is going to be video two, continue to talk about my client. Um, so overall, he wants to increase muscle size, lose fat, and cut some weight. I did explain to him that muscle weighs more than fat, so he should not rely on the numbers that show on the scale. Um, but a great way to measure his progress would be by taking measurements of like his um, like skin fold measurements, basically. So, or I could help him get measured uh, by measuring his waist and hip measurements to track the progress rather than just looking at the numbers on the scale because he's going to end up getting increased muscle size and he's going to see that the numbers are going to go up and he's going to be like, wait, I want to lose weight, so it's better to have him understand that uh, muscle weighs more than fat. So one way that we can measure his progress, like I said, is by the skin fold measurements or measuring his waist and his hip and doing comparisons like every week as shown here. Let me just show my screen very quick. So it's an article written by Elizabeth Quinn. Um, right here, she shows us the 7 areas that we could measure for him to keep a track of his progress. So we could measure his triceps, the pectoral, which is the mid chest, just forward of the armpit, subscapular, beneath the edge of the shoulder blade, mid axilla, midline of the side of the torso, abdomen next to the belly button, suprailiac just above the iliac crest and the hip bone, and the quadriceps middle of the upper thigh. I know it hurts, but this is one way to keep track of his progress since I don't have those fancy little computers that give you a 3D scan. Hopefully in the future I could get one so he won't be in pain. Um, anyways, so he is just starting again. I don't want to jump on heavy movements right away just because he could get injured. There's more risk of getting injured with going heavy. But I would rather start slowly with more compound movements, but like work on his muscle endurance first. Um, since also compound movements, I do like compound movements because you get to work like most of your big muscles, especially because he is short on time with school and work. Um, like as time passes by, I would like to work on his muscle strength so he could get stronger, for like everyday activities, start working on that core. As you're getting older, you don't want to be like slouched either. You want to have that nice posture as well. Um, there is this article here. It's written by Dr. Yessi. Um, she states, when starting a weight training program, strength is usually the main physical quality being strived for. However, in the initial stages of weight training, it may be more beneficial to first develop an endurance base before undergoing a training program specifically for strength. Keep in mind that for greater maximal strength, you must work out progressively. This means having gradually increasing higher intensity workouts. This in turn can bring a greater chance of injury, severe fatigue, and soreness if you are prepared for this work. This is why being on an endurance program that also produces gains in strength is more productive in the initial stages. It lays down the foundation for you to do the most effective strength training. And right here, she also states, in the 15 to 20 repetition max routine, you develop mainly muscular endurance, which is needed to develop the capillary base for greater blood circulation. This allows you to bring in more nutrients and to remove the waste products as you move into more intense training for greater strength. Depending upon the exercises that you use, you can also develop local muscular endurance that will directly enhance your sports performance. And yes, that's going to conclude my video for video 2. Thank you so much.